Welcome to Better Health. This is your chance to explore options for easy and sustainable weight loss through either surgical options or non-surgical, whatever works best for you. If you would like your questions answered live today, submit them by texting me. Texting, not calling, 248-935-2562. Or you can submit questions on Facebook or YouTube, wherever you're watching. When you choose a Hurley Bariatric Center, you are getting highly skilled board-certified surgeons who not only specialize in bariatric surgery, but critical care in a level 1 trauma center. With more than 6,000 procedures under our belt, your chances for a successful outcome are maximized with Hurley. Hannah Welter is going to walk us through non-surgical medical weight loss where you can lose up to 40 pounds in 3 months. But let's start with Dr. Gul Sachwani-Daswani, who is the Chief of Trauma and Acute Care Surgery at Hurley Medical Center. He has been voted best surgeon by the readers of My City magazine and is going to explain your bariatric surgery options. Dr. Sachwani?
Well, good afternoon, everyone. Thanks for having me here. As mentioned, today I'll be discussing some of the surgical options for weight loss that we offer at the Hurley Bariatric Center. As you all know, there are 2 paths for weight loss. One is the medical path and the other one is the surgical path. Medical weight loss continues to be a great option for patients. However, in the severely obese, less than 3% of the patients, according to statistics, have been noted to continue to maintain a healthy BMI less than 35, and that's where surgical options come into play for a long-term success. Long-term studies have suggested that surgical weight loss have demonstrated that surgical weight loss has a decrease in mortality. One of the landmark papers published years ago, the Swedish obesity study, demonstrated that there was a reduction in mortality up to 23% of patients that underwent surgical weight loss. And that was due to the positive effects that the surgery had on decreasing the incidence of diabetes, decreasing the incidence in cardiovascular events, and cancer. The way that surgical weight loss works is because we create some changes in the anatomy of the digestive system that helps in nutrient malabsorption. That is why after surgery we supplement your nutrients, because we create these changes, so then your digestion is sort of incomplete. We cause changes in gut hormones because we remove certain areas of the digestive system. We reduce hunger, increase satiety, and physically reduce food intake because of the restrictions that we cause. But surgical weight loss does not only benefit weight. There is plenty of other metabolic and endocrine positive results that happen because of the surgical weight loss. Some of them are improved insulin action, decreased blood sugar, and improved hemoglobin A1C. All of these parameters are related to diabetes, but it also helps in decrease the use of medications for heart and blood pressure. It increases and improves mobility, and overall it improves the quality of life. So who's a candidate for a surgical weight loss? Well, patients who have a BMI, which I will define shortly, which is body mass index greater than 40 or more than 100 pounds overweight. Patients also who have a BMI greater than 35 and have one of the listed associated obesity-related comorbidities, as you can see over there. Some insurance companies have noticed and have realized the benefit of surgical weight loss and have started to offer a surgical option for those patients that have a BMI less than 35 with type 2 diabetes. And of course, all those patients that have been unable to achieve a healthy weight loss and sustain it over a period of time due to prior efforts. So what is BMI? BMI is the body mass index. It's a calculation that takes into account the patient's height and weight, and it's used as a screening tool in our center by our team to be able to categorize patients into underweight, ideal weight, overweight, or obesity, I have to make sure that you understand that this is not a measure of body fat. It is a screening tool for us and our team. So what are some of the surgical options that we offer at our center? So one of them is the laparoscopic adjustable gastric band. This is a procedure that can take up to an hour, may require an overnight stay. It is a bit intricate because you have to do periodic adjustments to the amount of fluid that goes in and out of the band to better serve the patient. Some studies have suggested up to 46% of excess weight loss, but currently it's the least common performed procedure because of the unpredictability in weight loss. However, this procedure continues to appeal a subset of the population, and one of our senior surgeons, Dr. Farhan, does perform this at our center. Here's a diagram in which you can see the band, which has a balloon that's in a line, that's the one that gets filled with fluid, and we place it in the upper portion of the stomach to create a small pouch, and then they'll come to our clinic and we'll be able to adjust the amount of fluid that goes into that band based on the patient's symptoms. If they're too hungry, we increase it. If they're not able to tolerate any food, then we remove some fluid. And that's how the gastric band works. The next procedure that we offer is the vertical sleeve gastrectomy. This is the most commonly performed surgical procedure in the United States. Up to 70 to 75% of the surgical weight loss procedures are a sleeve gastrectomy. In this procedure, we remove up to 2/3 or 80% of the stomach. This allows us to preserve the pylorus, which is a portion of the stomach, so then it regulates how much food can pass through the rest of the bowels slowly and allow for nutrients to be absorbed. It also decreases the levels of the hormone called ghrelin, which is the hormone that gives us the sensation of hunger, because during the procedure we remove that part of the stomach. It's estimated excess body weight loss over the years approximately 60%, which is very good, and is usually recommended for patients with a BMI less than 50. Here in this diagram you can see what we kind of do is through the food pipe we introduce a sizer, and then with our surgical staplers we'll come and divide the excess stomach, leaving a vertical sleeve present over there, and then we'll remove the excess stomach out of the patient's body. The gold standard for surgical weight loss continues to be the Roux-en-Y gastric bypass. This procedure has both a restrictive and a malabsorptive component. It is mostly recommended for patients with type 2 diabetes or patients who have significant GERD, which is reflux disease, with either histories of ulcer or current inflammation of the esophagus and the stomach. The estimated weight loss percentage per year is very comparable to the sleeve gastrectomy, 60 to 70%, and is usually recommended for patients with a BMI greater than 50. Here in this diagram, just want to show you the rerouting that we do. We create a small stomach to which then we connect portions of the small bowel, and we reroute the small bowel in such a way that a lot of the portion of the digestion has been bypassed, so then absorption only happens lower down in the after the connections have been created. We are very excited that very soon one of our bariatric surgeons, Dr. Christopher Wong, will be offering another surgical weight loss procedure, which is called the CDS, which stands for single anastomosis duodenal ileal bypass with the sleeve gastrectomy and the duodenal switch. This over decades has been done in an open fashion. Minimal invasive techniques have advanced, and Dr. Wong will be pioneering here at our center. This procedure offers great weight loss, very comparable to the Roux-en-Y gastric bypass. It's actually tolerated better because it has less metabolic demands. It improves, just like the Roux, issues with diabetes, hypertension, cardiovascular, and other health conditions. It's complex what you see on the screen over there, but ultimately it's very similar to a sleeve gastrectomy. We create a long, skinny stomach, and then we reroute the bowels again to allow for digestion, a portion of the digestion to be bypassed, and absorption happens lower down in the small bowel. So here at Hurley Bariatric Center, we continue to strive and offer the best robotic and laparoscopic approaches that we have to surgical weight loss. We pride ourselves in being the first hospital in Genesee County to be able to offer a surgical weight loss using the robotic platform. And here's our team led by Dr. Jamal Farhan, Dr. Christopher Wong, and myself. Thank you very much for giving me the opportunity to present.
If you have questions for Dr. Sachwani, submit them by texting 248-935-2562, or you can submit your questions now on Facebook or YouTube. Dr. Tia is asking about lifestyle changes. Obviously, she says, you know, you have, what you eat and exercise are expected after surgery, but are there other lifestyle changes that come with having the surgery?
Honestly, coming into our center, you will be put together with a team. And yes, lifestyle changes are very important, and nutrient supplementation after surgery is one of the most important. So yes, together with a healthy lifestyle which will train you on food and exercise, there are some supplements that you will have to take after your surgery.
India is asking about dangers, and it also falls into some other questions that we're getting about problems after the surgery. One person says that they hear that you may need your gallbladder removed, and somebody's asking about alcoholism, if that chances of that increase by having gastric bypass.
So let me tell you about, you said the complications that they asked. You know, there are what we call early or early complications and late. Early, as we always mention, and we counsel you extensively through the evaluation process, bleeding, infection, and leaks from either the sleeve or the bypass. Late, what I think so they're referring to is when they have the gallbladder complications, because unfortunately when there is a rapid weight loss, it can cause changes to the gallbladder and liver function. So yes, your gallbladder may need to be removed. That happens on a case-by-case basis. And other complications that can happen is if you don't follow the diet appropriately, what we call dumping in the gastric bypass. But with our nutrition team and our dietitians, we have minimized the amount of dumping syndrome that our patients have through extensive education.
And the gallbladder, just to clarify, I mean, that's from rapid weight loss, so it's not something that's really connected to the surgery. If you lose weight on your own and you do it fast, it's the same thing, right?
Absolutely, absolutely. This is because of the rapid weight loss and the changes that it causes in the biliary system. It's not because of a complication of the surgery.
How long are you typically off work after having one of these surgeries?
4 weeks. Typically, it's 4 weeks. Some people return to work even earlier, depending on their work.
Joanne had quite a lengthy question, but the gist of what she's saying is that she had gastric bypass about 25 years ago and kept the weight off for 15 years, but then had some health complications and the weight creeped back up. And she's wondering if, you know, do you have gastric bypass again, or what happens at that point?
Very valid question. I would suggest to Joanne to really contact our team, because I don't think so rushing into a revision, what we call a revision of the bypass, is necessary at this time. She needs to be counseled and meet our team that will be able to guide her through a weight loss process.
And I got another question about renewal again, but anybody who thinks that maybe they had bypass before, or they're, you know, now they're struggling years later, that's something to make an appointment, right?
Yes.
That you discuss?
Absolutely. Please make an appointment, because we can, together with the help of our bariatric team and the dietitians, we can figure out pitfalls that could be contributing to the inadequate weight loss. So by all means, make an appointment, get referred to our center.
And I think this is the last question, but Tia said if you already don't have a gallbladder, would that prevent you from getting the surgery, or they're not
Absolutely
connected?
not. Absolutely not. You can still proceed with any surgical weight loss options, even if you've had your gallbladder removed.
Okay, great. Thank you so much, Dr. Sachwani. Next,
Thank
we
you.
hand things over to registered dietitian nutritionist Hannah Welter. Hannah is part of a team of people who help you every step of the way on your weight loss journey for those choosing a non-surgical route. She has seen countless people finally be successful at losing weight because they are following our trusted program with the support to make it work. Hannah will also be answering your questions live after her presentation. Text now to 248-935-2562 or submit your questions on Facebook or YouTube. Hannah?
Yes, hello. So my name is Hannah Welter. I'm one of the dietitians at the Hurley Bariatric Center. So we just heard Dr. Sachwani talk a little bit about the surgical options that we offer through the Bariatric Center here at Hurley. I'm going to touch more base on the non-surgical medical weight loss program that we have there as well. So in terms of weight loss, I think it's important that we first start to understand what overweight and obesity actually is. We distinguish overweight and obesity based on something called your BMI, so your body mass index. If you aren't aware of what your BMI is, you can actually just go online and look up BMI calculator. It's a pretty simple calculation where they'll spit out a number at you. What we do is we take that number and it kind of falls into a weight class category, whether you're underweight, normal weight, overweight, obese, whatever it may be. But in terms of overweight and obesity, overweight is based on a BMI of 25 to 29.9, and then obese would be of a BMI of 30 or higher. Again, I know Dr. Sachwani kind of touched base on that, but that is something that we use if you are starting the non-surgical medical weight loss program to see if you would be a candidate that could move forward with us. In terms of overweight and obesity, weight gain and weight gain over time, it's definitely multifactorial, so there's a lot of things that can impact your weight. A lot of those underlying causes. So I think one of the first things that people think of is definitely diet. If you are chronically eating high fat, high caloric foods with not a true or a lot of the nutritional benefits for you, definitely over time can cause some weight gain. Right alongside of that is definitely some lifestyle habits. When I think about the U.S. and Americans, a lot of people have very just sitting jobs where we don't move a lot throughout the day. So leading and living that inactive lifestyle can definitely lead to some weight gain. In terms of genetics, your genes can impact how much and where you store fat on your body. There's also a very direct parallel between families, and typically families, they follow the same guidelines in terms of eating habits, physical activity, whatever it may be. So your genetics can definitely play a role. In terms of your environment, I think it's pretty obvious. You drive down any road in America and there's a lot of fast food out there. There's a lot of advertisement for those highly processed foods. If you eat those in abundance over time, it can cause that weight gain for you. Other chronic health problems, so we can think of different problems such as PCOS, or maybe you have an underactive thyroid or Cushing's syndrome, something like that. So if you have one of those other chronic health problems, 100% that can make it more difficult for you to lose weight and also cause you to gain weight. And then the last thing that we look at is medications. If you're taking a medication, maybe it causes you to retain fluid and make your weight go up. Maybe it causes your body to decrease the rate that it burns calories, or maybe it causes you to have a bigger appetite. So over time, those are all some of those underlying causes that can lead to overweight and obesity. So how can we manage overweight and obesity, Again, kind of what I said earlier, I think the first thing that everybody thinks about is diet, of course. That is something, if you decide to move forward with the non-surgical medical weight loss program, we focus a lot on diet and eating habits during that time, so I'll kind of touch on that in a minute. Exercise goes right alongside with that. In terms of behavior therapy, that is also something during the non-surgical medical weight loss program that we will focus on. An example that I like to give is, I think in the U.S. we focus a lot around food in terms of social gatherings, family gatherings, baseball games, basketball games, whatever it may be. There's always food there. And during the program, we kind of start that behavior therapy and look at situations like that differently. Whether it's Thanksgiving or whatever it may be, instead of focusing on the food, maybe we focus more on getting to know our nephews and our nieces and hanging out with our family or whatever it may be. So behavior therapy is always a big thing that we talk about as well. In terms of medication, I don't think it's a secret that in the past couple of years, weight loss medications have definitely been a topic of discussion for a lot of people. Different medications like Wegovy or Phentermine, Adipex. There was a new medication that was approved by the FDA recently called Zepbound, very similar to patients that are diabetic that take Mounjaro. So if that is something that you're interested in during that 12-week program, we do look at those medications as well. It's largely driven by your insurance and insurance coverage, but it is something that we can talk about also. And then, like Dr. Sachwani said, another way that you can manage overweight and obesity would be weight loss surgery as well. So, the non-surgical medical weight loss program and what it's all about. The main thing that we focus on during that time is we want to help you achieve better health. We want to help you achieve a better quality of life through weight loss. One of the main things with that is it is individualized. So when you come to the clinic for that program, don't expect to be in like a group setting. It's going to be one-on-one, so it's very individualized to you and your own personal health history. We want to show you that behavior change is the foundation of a good lifestyle change. We want to show you how to make those positive diet and lifestyle changes that you can stick with long term as well. And then, of course, we're always there to support you through the entire process. So, who is eligible for the non-surgical medical weight loss program? So first of all, you do have to be an adult, so that means you have to be 18 years or older. Your BMI, so what I referenced a couple minutes ago, your BMI or your body mass index, that has to be greater than or equal to 25. If you are interested in losing right around an average of 30 to 50 pounds, that is typically what we see that patients lose over that program time. In terms of the diet and the lifestyle changes, we want to see that you are ready to commit to those diet and lifestyle changes as well, and we want you to make sure that you're ready to enjoy that better health and a better quality of life. How does the program work? One of the main things, and one of the main questions I feel like we always get asked is the program fee. So it is $599 and it is not covered by insurance. During the 12-week program, so that's how long the program lasts for, it's 12 weeks, you will pay that $599 up front, but the $599 does cover all of the supplements that you will be consuming during the first 2 weeks of the program. It also covers all of the dietitian visits during those 12 weeks, and it also covers all of like the education materials and things like that you might get. But it is $599, again, not covered by insurance. We base the program off of the 4 pillars of weight management per the Obesity Medicine Association. So those 4 pillars include nutrition, physical activity, behavior, and then medication if indicated, kind of how I mentioned earlier. So like I said, it is a 12-week program. It is those individual clinic visits. So if you do sign up for the program, expect to come each week for 12 weeks. During all of those visits, we'll take your weight every week. We'll see how you've been trending. You will meet with different providers each week, whether that is our registered nurse that we have in the clinic, whether it's one of the dietitians as myself, whether it's the nurse practitioner. You'll be seeing one of those providers each week during the 12-week program. We do take different biochemical markers at the beginning of the program. We look at certain things like your A1C, insulin levels, your thyroid levels, whatever it may be, and then we do retest them at the end of the 12 weeks to see how they improved for you. You will have that medical monitoring with the PA, more than likely the nurse practitioner that we have in the clinic, so she will go over all of those labs with you, see how you're doing. They would also be the one, if you were interested in weight loss meds during those 12 weeks, she would be the one that would kind of talk to you about that as well. You will be given those educational handouts, educational videos via email if you're interested in that as well, and then again, like I mentioned earlier, the medication if needed. So the program phases. The first 2 weeks of the program, we call that the jump phase of the program. So as I mentioned earlier, when you pay that $599 up front, that covers all of the supplements that you will be consuming during the first 2 weeks of the program. So that jump phase of the program, you are only consuming meal replacement supplements and other high protein like snacks and foods such as protein chips, beef sticks, high protein cereals, things like that. So the first 2 weeks of the program, it's basically all meal replacement supplements for you. After the 2 weeks is over, you then meet with one of the dietitians. We start to transition your diet. We'll take away some of those supplements and then we will add in more food-based meals, snacks, things like that. And we teach you exactly what those meals should look like, portion sizes, calories, and everything. You then continue in that manner for the rest of the 12 weeks. As time continues to go on, we continue to transition your diet, but you meet with one of the dietitians every time that your diet does transition. After the 12 weeks is over, you can continue to follow with us. We call that the maintenance phase of the program. During that time, you have the option to continue to follow with the nurse practitioner that you will meet during the program and also one of the dietitians as well. I think that's very beneficial to everybody. So after those 12 weeks are over, it's not just you're free and on your own. You have the ability to come back and continue to follow with us to continue with your weight loss during that time as well. So, is the program right for you? The non-surgical medical weight loss program, it may be the right choice if you have tried dieting on your own and you haven't had any success. Again, you're coming in each week for 12 weeks. I think the accountability during those 12 weeks is really helpful for people, just to help you in terms of you're coming in, you want to do well, but also allowing us to help you to make those habits for yourself and kind of learning what that healthy lifestyle should look like. If you prefer to lose weight without surgery or do not qualify for bariatric surgery, as Dr. Sachwani mentioned earlier, in terms of bariatric surgery, you do have to have a BMI of 30 or greater. If your BMI is falling below that and between that 25 to 30 range, maybe the non-surgical medical weight loss program is a good option for you. If you're worried about other health issues such as high blood pressure, high cholesterol, diabetes, sleep apnea, whatever it may be, those are all certain diagnoses or past medical history that we can help with during those 12 weeks as well. So we usually see an improvement with a lot of things like that. The special discount offer. So if you contact the Hurley Bariatric Center by Wednesday, February 14th, you will be given a $100 discount on the program fee. So instead of that being that $599, it will drop down to $499. Just making sure that you contact us before February 14th to get that whole process started. I'm going to shift gears just for a second. This kind of goes back to what Dr. Sachwani was talking about earlier. So if you are somebody that has had bariatric surgery, and I know that he was getting some of those questions about some patients that had some weight regain after bariatric surgery, we do offer a regain program. It's for post-surgical, or called the post-surgical medical weight loss program, but we refer to it as regain. The regain program is only for Hurley Bariatric Center patients that are post-surgical. So again, if you're not one of our patients already, you can reach out to the clinic and see if we can take you on as a transfer of care patient. During that time, you'll meet with one of the surgeons, you'll meet with the dietitians, the nurses, whoever it may be. And then if you are interested in the regain program, that would be something that we can work with for you. You do have to be at least 1 year post-op, preferably at least 18 months post-op, but at least a year post-op. You also, if you are already a patient of ours at the Hurley Bariatric Center, you have to be up to date on all of your post-op visits as well. Basically, the regain program is for people that maybe have gained weight after having bariatric surgery, and they kind of want that assistance and that guidance to kickstart their weight loss again. The program is very, very similar to the non-surgical medical weight loss program that I just went over. Again, is not covered by insurance, so the upfront fee is $370. Again, that fee does cover all of the supplements that you will be consuming for the first 2 weeks of the program, in addition to the dietitian visits and all of the educational materials. We base it on those same 4 pillars of weight management, so nutrition, physical activity, behavior, and then medication if needed as well. The only difference between the regain and the non-surgical, besides already having bariatric surgery with the regain, is it's only an 8-week program. So again, it's individual clinic visits. You will come each week for 8 weeks. We do your weigh-ins. We will have the nutrition counseling with the dietitian. We'll look at your labs. We'll monitor your biochemical markers. You have that medical monitoring with the nurse practitioner or the physician assistant. Again, medication if needed. The first 2 weeks, again, are all supplements for you, so you'll be having high-protein meal replacement shakes, again, protein chips, protein bars, beef sticks, whatever it may be for the first 2 weeks. You then meet with the dietitian, we transition your diet, we start adding in more food-based meals, food-based snacks, and we continue throughout that process over the 8 weeks. If you are interested in either the non-surgical medical weight loss program or the regain program, you can just call the number that we have up on the screen, the 810-262-2330. Our receptionist can kind of direct you to whoever you would need to call or talk to get in touch to start one of those programs.
Okay, here's your last chance to submit a question to Hannah by texting 248-935-2562 or submitting questions on Facebook or YouTube. There was a lot of information there.
Yes,
can you kind of talk a little bit, just so people understand, what you're seeing with patients that come in and go through these programs? Are people losing weight?
Yes.
Do you see people who haven't been able to lose weight other ways, and this finally worked for them?
So I think a big part with the non-surgical medical weight loss program, so again, on average, we typically see that the average patient loses 30 to 50 pounds during those 12 weeks. I like to point out you are going to get out of it what you put into it. When it comes to success with the non-surgical medical weight loss program, the patients that follow the guidelines and they follow the meal plan and they take our recommendations and they call if they have trouble or if they have questions, they are the ones that are successful during those 2 weeks. The patients that maybe they don't follow everything exactly, and during the first 2 weeks when you're on meal replacements, that is when you see a big majority of that weight loss because it jumpstarts it for you. If you're not following that during the first 2 weeks, you're going to see that your weight loss for the rest of the 12 weeks may be a little bit slowed or a little bit lower. Again, not saying that you're not going to be successful even if you do that, but with the program it really is you get out of it what you put into it.
But if you follow the program, 30 to 50 pounds in 3 months, I mean, that's the answer a lot of people are looking for.
Yes, no, 100%.
Okay, let's see. Christy wants to know, how do people figure out what type of diet's best for them? There's low carb, low fat, low calorie. It seems like there's so many different kinds.
So it's impossible for me to sit here and tell you, oh, you should be eating this exact amount of calories without knowing your current weight, your height, whatever it may be. I will say one of the main things that I would recommend that you start doing right now is try to start keeping a food journal, preferably a food journal that kind of counts calories and protein and fat and carbs for you. I find a lot of the time when patients start keeping a food journal, that is when they realize, oh, I didn't realize I was drinking pop this much, or I didn't realize I was having fast food this much, or I didn't realize this food option had this much fat in it, whatever it may be. Instead of focusing more so where you should remove things, focusing more on where you can add whole nutrient-dense foods, choosing your lean proteins, getting in your non-starchy vegetables at all of your meals, choosing high-fiber carbohydrates that keep you fuller for a longer period of time and don't cause those blood sugar crashes or whatever it may be. So in terms of an exact diet, I understand there's a lot out there in terms of recommendations and information, but the main thing that I would recommend is start keeping a food journal, see what little changes you can make here and there, and then if you do decide to move forward with the non-surgical medical weight loss program, that is something that we will give you instructions on once you start the program.
Patricia's asking how to start weight loss the natural way.
Yes. So again, that kind of goes back to what I just answered. So I would recommend start with your food journal. Focus on your whole foods. A lot of the times, and again, it's just the way that the U.S. caters to society with everything we put out there, but really trying to focus on those whole foods. Maybe you've heard before that you should shop the perimeter of the grocery store. That is a lot of the times that's where those whole foods are. It's where you're going to get your lean proteins, your vegetables, your fruits, whatever it may be. It's when you start getting into some of those middle aisles that we see a lot of those processed foods that I kind of call them empty calorie foods, where they don't provide you with much nutrition there, so you're kind of just eating calories and not getting a ton of benefit out of it. Where if you focus on those whole foods, you're going to find that you're going to stay fuller for longer, but your total calorie intake is going to be less, and you should see that the weight kind of starts falling off.
Mary says she's on Trulicity and a diabetic. She's tried many programs with not much success. Why is this program different?
So I think with the non-surgical medical weight loss program, first of all, we are going to monitor your A1C over the 12 weeks. So we're going to take your A1C at the beginning of the 12 weeks, and we're going to see where you're at the end of the 12 weeks. And usually we see an improvement with everybody. I think the difference with us, it's the accountability. You know you're coming back every week for 12 weeks to see one of us. And it's not going to be virtual. It's not going to be over the phone. You are going to come in and you're going to get that actual conversation with us, where I'm going to be able to look at your food journal and say, okay, so maybe you had a low blood sugar this day, or maybe you had a high blood sugar. Let's see what you ate and what we could have done to correct it. That way in the future, you know how to handle a situation like that. So it's definitely the accountability and learning as you go, where if you don't have that, you're kind of just up in the air and you don't have much guidance.
I have a couple of really specific health questions. Somebody with high blood pressure is wondering, is there certain pills they shouldn't take, or someone's on Xarelto, with a history of pulmonary embolisms, and they're wondering what kind of precautions to take. I mean, that's one thing why this program's different, right? Because it is medical.
Yes. So upon starting the program, you will actually kind of come to like an intake appointment, I guess is what we would call it. At that appointment, you would meet with our nurse practitioner. She looks at all of your past medical history. She looks at the medications that you're on. If we think or if we know that there might be some type of correlation or whatever it may be, either they will send you to get some type of clearance, whether that's cardiology clearance, nephrology clearance, whatever it may be, if that's needed before the program. But we also will look at all of your medications and see if there's a certain side effect, if something's going to interact, whatever it may be. In terms of our charting as well. So the charting system that we use, a lot of different doctors' offices also use the same charting system, so that's helpful. Your primary care doctor, if you see a nephrologist or whatever it may be, they can go into your chart and they can see all of our notes and they can see what we're having you take, what we're prescribing, what multivitamin we want you to take. So that's very helpful. So it is a full circle of care. It's not just that you're coming in to see the dietitian, I'm only going to look at your food. You're going to see the nurse practitioner, you're going to see the nurses, and then your other providers can see all that information as well.
And that's so important because, you know, so many times people might go to their doctor, oh, I'm on a weight loss thing. Well, what supplements are you taking? What are you doing? How are they doing this?
Mm-hmm.
They have so many questions. Your primary care could just look in your chart and they know it's all working hand in hand, right?
Yep, they should be able to see everything. And again, call us. I always say that as well. We're only a phone call away. If you have a question, if your primary care has a question, they can always call us and we can explain anything in detail. But I think that is a big benefit of it as well. You're getting that full circle of care from everybody, but we're able to talk and discuss with other people if needed as well.
Just one thing from what you were saying, I just wanted to clarify, you know, the 2 weeks jump start with the supplements, then you start adding in food. We're talking real food. You
Yes.
go to the grocery store and
Yes.
you're buying.
Yes. So
regular food.
so I'll try to explain a little bit better. So the initial program fee is the $599. So again, we do have that discount fee, but the $599 that will cover all of those supplements that you take during the first 2 weeks of the program. So the first 2 weeks, you are not having any outside food. We give you this full box when you come to your initial appointment. It has all of your protein powder. It has all of your high protein snacks, whatever it may be, whatever it is. You then will come to your 1 week appointment, your 2 week appointment. At your 2 week appointment, you will meet with a dietitian. I'm going to look at your food journal. I'm going to see what you've been doing. Hopefully you've been following all of the supplements for the first 2 weeks. And then I'm going to teach you, okay, we're going to take away one of these meal replacement supplements and we are going to add in a grocery store meal. I'm going to teach you then, this is what that meal should look like. This is what your portion size of protein should be for you. This is how many vegetables I want you to eat at that dinner meal. This is how many carbs I want you to eat at that meal. You then continue with that for a couple of weeks. You come back and see the dietitian again, and that is when we then take away another meal replacement supplement, add in another food-based meal, food-based snack. So as time goes on, you aren't just going to be on supplements for 12 weeks. We are going to add in more food-based meals.
Okay, thank you so much.
You're welcome.
And thank you for joining us. We know losing weight can be hard, but you don't have to go it alone. Join the thousands of people who have turned to Hurley for help and have found great success. You can call 810-262-2330 for more information or for an appointment, or head over to hurleymc.com. We do want to thank Mid-Michigan Now for being great broadcasting partners for today's Healthy Living event. Have a great day, everyone.